my name is Dr. Zelaya. I'm with Airrosti, and today we'll be discussing general leg pain. We'll be reviewing common causes of general leg pain, also signs and symptoms that may indicate that you have a leg condition. Additionally, how traditional healthcare approaches general leg pain and how Airrosti is a little bit different. Let's get started. All right, now let's talk about some common causes of general leg pain. General leg pain can be very general, and it can array from an overuse injury, wear and tear, to a possible nerve condition. It's commonly seen in athletes, people who do a lot of prolonged sitting and or standing, even someone who's taking up a new activity such as walking and even running. All right, let's talk about signs and symptoms that may indicate that you have general leg pain. Let's divide into upper, lower, and entire leg pain. Starting with upper, if you're experiencing upper leg pain, it could possibly be coming from your quad muscles, which are four muscles that attach from the top of your hip down to your knee. You could be having outer leg pain, which could be coming from your iliotibial band, also known as IT band, that goes from the very top of your hip down to your knee. You could also be experiencing back of the leg pain, such as your hamstring muscles that attach from your sitting bone down to your knee. They're usually associated with a sharp, dull ache or even a throbbing pain. It's commonly seen in athletes who have a quick sport such as football, track, and or tennis, or people that do a lot of prolonged sitting and or standing. Moving on to lower leg pain. If you're having front lower leg pain, it could possibly be shin splints. If you're having back of the lower leg pain, it could be a calf, and even lower than that, it could be Achilles tendonitis. It usually feels like a sharp, dull, throbbing pain. It's seen in patients after activity or someone who has taken up a new activity such as walking, running, and even biking. And lastly, entire leg pain. This is commonly known as referred leg pain, which means it's coming from somewhere else in your body, such as your lower back. In your spine, we have a nerve called the sciatic nerve that comes out from the low back spine. It pierces a deep glute muscle and it travels down the leg. Patients with a true sciatic nerve condition due to compression of the nerve typically experience entire leg pain, along with numbness and tingling, burning, and even pain-like sensations such as pins and needles. This could be from an acute strenuous activity or simply wear and tear. Again, if you're having entire leg pain, just know that it could be coming from somewhere else in your body. Now let's discuss how traditional healthcare typically approaches general leg pain. They may recommend rest, ice, compress, elevation of the leg. They may prescribe a pain medication to help alleviate the pain, a possible injection, referring out for imaging, and in a worst case scenario, they may even recommend surgery. Now let's talk about how Airrosti is a little bit different. At Airrosti, you're with your treatment team for a full one-on-one hour. The first 30 minutes, you'll be with an Airrosti certified provider, walking you through a thorough exam to make sure that you're in the right place with a proper diagnosis of the root cause of your injury, followed by hands-on manual therapy. The second 30 minutes, you'll be with a certified recovery specialist walking you through your active care exercises that you can continue doing at home to make sure we make great progress. We hope the information presented was helpful. If you or someone you know is dealing with general leg pain, please reach out to Airrosti by clicking here. We offer in-office and telehealth appointments. Please also check out our other videos and subscribe to our YouTube channel. We'll see you next time.